All right, it's top of the hour and we have still more people coming in, but we're going to start because I know how important it is to start on time and end on time. So we've got lots to talk about. Okay. Today's webinar is on Medicare planning, healthcare costs, and retirement. As advisors, we tend to see Medicare being one of the largest expenses people have in their retirement years. It also is one of the categories that adds confusion and complexity to people's retirement, but also it's one of the categories that a lot of retirees under budget for. They never think about the costs of healthcare during their retirement. So we're going to touch on that and really get into a little bit as an overview of what Medicare is for you today. So first of all, let me do an introduction. My name's Tom Mitchell, and I have had the honor of leading the OneAZ Wealth Management team of wealth advisors located here at the OneAZ Credit Union. Our full-time staff of professional advisors are assisting clients and members of the OneAZ Credit Union all over the great state of Arizona. We're very excited to bring you these types of educational events and webinars to you. Matter of fact, if you have a pencil, please write down, I'll give you a couple dates. One, October the 25th. October the 25th will be a webinar on women in investing. Whether you're old or mature, whether you're single, married, divorced, or widowed, doesn't matter. It will all be covered and helping you as women understand the importance of investing and understand some of the issues when it comes to investing. So we're going to have a deep dive on that. We've got a great presenter and a great materials to share. So again, October the 25th is Women in Investing. Then on November the 2nd, I'm excited for this one because this is a webinar specifically for business owners. It's succession planning for business owners. Business owners build their lives and they grow their small or medium-sized businesses, and then they want to hand it off, sell it off, or transition it, maybe to family members. Well, there's lots of strategies you need to think about. So we're going to be presenting a great webinar on that on November the 2nd. That's for business owners, succession planning. And then last webinar of the year will be on November the 14th. November the 14th is going to be Social Security. It is our biggest and most well-attended webinar normally because lots of great questions about Social Security, understanding the program and the system, how to maximize your benefits. Again, decisions that are made about Social Security will truly impact you for the rest of your lives. So the earlier you know what decisions to make and pre-planning, the better off you're going to be. So a lot of good webinars coming up. Again, October the 25th, November the 2nd, and November the 14th. You can check them out on our website. Matter of fact, here's our informational page for this webinar. It contains our legal requirement disclosures for your convenience, but also please check out our OneAZWealth.com website for those upcoming events. For better audio, today's webinar is going to be in a listen-only mode. We are recording this event and we will be posting it on our website in about 2 to 3 days. Once we get it edited and get it organized, it'll be on our website for you to review again and again. All of our materials, even the handouts, will be there as well. Now, we will be fielding questions, and many of you have submitted questions already. We're excited. I think we had up to 32 questions already submitted for today. I don't think we're going to get to all of them. We're going to get to as many as we can. But if you have questions and we didn't get to them, I promise you, we will reach out to each and every one of you individually to make sure your questions were addressed. So again, if you have questions even after the webinar, please email them to oneazwealth@oneazcu.com. Last, for more information about just OneAZ Wealth Management overall and the team of advisors, I again urge you to go to our website, oneazwealth.com. You can use your mobile device and you can scan the QR code that's on the screen right now. You can also connect with us on social media with Facebook, LinkedIn, YouTube for more exciting resources as well as helpful information. So let's get started. Our OneAZ Wealth topic today, again, is Medicare, planning healthcare costs in retirement. I have our OneAZ Wealth Advisor, Robert Savage, presenting today's webinar. And Robert actually joined us this past year. Previously, he was with Bankers Life Securities. And in 2021, he completed the rigorous curriculum to earn him the respected Retirement Income Certified Professional. That's the RIPC designation from the American College of Financial Planning. Now, prior to becoming a financial advisor, Robert was an accomplished attorney. He also graduated from the University of Arizona College of Law back in 2000 with a JD degree. He also holds a bachelor's degree in history from the Portland State University. So without further ado, I'm going to turn it over to Robert. Robert, are you there?
I am, Tom. Thank you for the introduction. Appreciate the opportunity to be here with everyone today. Looking forward to going over a little bit more information about Medicare and how that works, and get everyone some information that helps them in making some important choices. So everyone, again, welcome to today's discussion on Medicare. I want to get started. Number one, giving you guys some of the disclaimers. The content of this preservation is provided for informational purposes only. We should not be construed as investment, tax, or legal advice, or as a solicitation to buy any specific securities product. We'll go over some hypothetical scenarios, but they're just that, and I highly encourage you to speak with your trusted advisors to make these decisions that are based on your specific situation. The chances are, if you're on this webinar, your mailbox is full of information relating to Medicare. Your probably email inbox is full as well. You're receiving telephone calls and perhaps even some knocks at the door to help give you some information about Medicare. Most of that, frankly, is solicitation from various companies who want your business for Medicare. And while there's nothing inherently wrong with that, our goal today is to provide you with some basic information so that you can make informed decisions on your Medicare choices. So our agenda today, we'll be sharing a quick overview of Medicare, including the enrollment process, the coverages and costs of original Medicare, and the options you have either in terms of Medicare supplement plans or Medicare Advantage plans to help address the cost of healthcare in retirement. Before we go any further, I do want to give a thank you to Nationwide and the National Council on Aging. Nationwide doesn't sell any products that have to do with Medicare, but they recognize that your Medicare choice is an important retirement decision. And as such, they want to make sure that folks have that information to make good decisions on how to address healthcare costs in retirement. And they've teamed up with the National Council on Aging, which is the country's longest serving national organization focused on aging. So those two organizations work together to provide you with access to an unbiased tool that helps you sort through your Medicare options, and I'm happy to help kind of guide you through that.
In fact, Robert, the handout guide that we make available to those that attend this webinar actually comes from them. And it's a wonderful guide to really bring down the complexity down to the simple and easy to understand. So we'll have that guide for any of those that attend the webinar.
Perfect. Thank you, Tom. So what is Medicare? It's a federal health insurance program for people age 65 or older, or those who are disabled or suffer from certain diseases. Generally speaking, to be eligible for Medicare, you're going to be someone who's 65 or older. If you've qualified to collect Social Security benefits and have a sufficient work record, you're a citizen, and you're a permanent, or at a minimum, a permanent resident for at least the last 5 years. Even though you may not receive Social Security benefits, or even though as a public sector employee, you may still qualify for Medicare, but the rules are a little bit different in that circumstance. People under 65 can apply for Medicare if they have a qualifying disability or one of two diseases, ALS or advanced kidney disease. And in those situations, there's no waiting period. Typically, if you're on disability, you have to wait for 24 months before you can go on to Medicare. However, if you have Lou Gehrig's disease, that waiting period is waived.
I'll just call that out because this is again, a confusing item. Some people think they can get it maybe when they start their Social Security, if they elect Social Security early, say at 62. But the fact of the matter is Medicare comes in when you turn 65.
That's correct. So if you're going to retire early, even if you do take Social Security age 62, you still have to look elsewhere for your healthcare coverage until you reach that age 65 milestone. Thanks, Tom. So we'll talk about the various parts of Medicare in a minute, but let's first chat about enrollment. So if you're already receiving your Social Security benefits, enrollment into Medicare Parts A and B is automatic. Your effective date will be the first of the month in which you were born. In that instance, you'll receive a Welcome to Medicare packet, including your Medicare and You booklet from the Center for Medicare Services, and it'll have information about any additional steps that you might need to take. There's an exception to the initial enrollment period if you continue working past age 65 and you continue to have health insurance through your employer. If that's the case, or depending on other specific facts, you might qualify for a special enrollment period when you do leave your employer's plan. However, if you do miss your initial or special enrollment period, you can still enroll for Medicare late in what they call the general enrollment period from January 1st to March 31st of each year. However, you may be subject to some penalties on that. Overall, if you're not taking Social Security, you're looking at enrolling in Medicare the 3 months before your birth month, the month of your birth, and the 3 months afterwards. So let's talk about what happens if you're going to continue working and you still have the option to have coverage through your employer. You essentially have 3 options. You can stay enrolled in your employer's plan. You'll have a penalty-free opportunity to enroll in Medicare later. Second option is that you can drop your employer's coverage and enroll in Medicare early, or you can explore a combination of both. We're going to go over the various parts of Medicare and the options on coverage. It is my strong suggestion that if you are going to continue working, that you speak with a professional to look at exactly which of these options is right for you in your particular situation. So let's go over the different parts of Medicare, what it covers, what it doesn't, and what the various costs and coverages are. So as most of you may know, Medicare is divided into 4 parts, parts A, B, C, and D. Part A is your inpatient hospital coverage. So it covers your inpatient stay at a hospital. It will also cover some skilled nursing care after a hospital stay for a short period of time, hospice care, and also some home health care, assuming that you meet the qualifications for both skilled nursing care and are also confined to your home. One thing that's important to note here is that Medicare does not cover assisted living or traditional nursing care, what they refer to as custodial care. So that's a big expense that you should be talking with your financial professional to plan and prepare for, because it is something that is not covered by Medicare, and Medicare makes a point of putting that in bold print several places in their Medicare and You booklet. So Part A for most folks is free. So provided you've worked more than 40 calendar quarters or more, so essentially 10 years, you don't have a Medicare premium for Part A. And then even though there is no premium for Part A, there are various deductibles, copays for Medicare Part A. So the first one is, and most folks know that have employer plans are familiar with deductibles. Typically, when you're dealing with an employer plan, you're familiar with an annual deductible, which is essentially an amount that you have to pay before the insurance coverage starts paying benefits. With Medicare Part A, that deductible is a little bit different. It is not an annual deductible. Instead, it is a per benefit period deductible. That benefit period is equal to 60 days. So that means if you're admitted to the hospital and you're released, and then more than 60 days later, you're admitted to the hospital again, you could be hit with that deductible again. Theoretically, it's possible to have that deductible be applied 5 times in a calendar year, which would amount to $8,000, assuming you had those 5 hospital visits separated by that 60-day benefit period.
Again, a call out that many people think it's like the traditional insurance deductible. It's not annually, is it? It's per benefit period.
Yeah, then that's usually a big surprise for folks, is that this deductible is not annual, and nor is it your only expense when it comes to Medicare Part A hospitalization coverage. In addition, if you have a lengthy hospital stay, you have then copays. So again, most of us who have had employer coverage are familiar with copays. Those are set amounts that we have to pay for a certain service or procedure. In the world of Medicare Part A, what that means is if you're in the hospital for more than 60 days, you have a daily copay. So days 61 through 90, that daily copay is $400 per day. So that amount, if you were in for that full time period, could amount to another $12,000 on top of the $1,600 deductible that you've already paid. If you have an even lengthier stay than that, the copay doubles for days 91 through 150. So that, again, imagine a 150-day hospital stay, and suddenly you've got a total bill that's over $60,000 under traditional Medicare. So we've covered a lot of the information on this slide. So we've got the deductible of $1,600. We just went over the daily hospital copayments. Let's talk about the daily skilled nursing facility copayments. So Medicare does cover what they refer to as skilled nursing care after a hospital stay. To qualify for that skilled nursing care, you need to have been admitted to the hospital for a period of 3 days, not including your day of discharge. You have to have the care prescribed by a doctor. The facility has to agree, and you have to be making improvements. If you meet all those criteria, Medicare will pay for the first 20 days of skilled nursing care. After that, for days 21 through 100, you have a daily copay of $200 per day. If you're going to stay in skilled nursing past day 100, you're now 100% responsible for that cost of care. And so Medicare does not have a maximum amount of pocket. And again, that's why I reiterate, this is not a substitute for nursing care. Medicare does not cover that expense. So now that we've covered Part A, let's take a look at what Part B covers. Part B is your actual medical coverage for things like outpatient services. So when you go visit the doctor, if you have to go see a specialist, things of that nature. Preventative services, anything that's medically necessary is covered by Part B. Next slide, Tom.
Yep.
So on Part B does have a premium. So the Part B premium for most people is $164.50 per month. And that's again for this year, 2023. Medicare has not released their 2024 premium amounts yet. But the other notable exception is that if you are a higher income household, your Part B premium can increase. So for those who are married and have a modified adjusted gross income of more than $194,000, you're going to see an additional Medicare Part B premium added on. That modified adjusted gross premium, by the way, captures a variety of things that are not included in your adjusted gross income on your tax returns, including the non-taxable portion of Social Security, and any interest you earn from tax-exempt sources are also included in your modified adjusted gross income. So very important when you're making the decision to go on to Medicare, getting ready to retire, to sit down with your financial professional and look at this issue as well, see if there's a way to structure your income so that you don't get into some of these higher Part B premium tiers.
Just to reiterate that, Robert, that is so true. This is an area we see time and time again when people start to get they get their Medicare, and all of a sudden they discover that something that happened 2 years earlier actually is triggering a much higher premium that they need to pay. It's, for example, if you just use the example of somebody having an IRA and they wanted to roll it over or really transfer it into a Roth, convert it into a Roth. Well, whatever they had in that IRA would be a taxable event. That taxable event, let's call it $500,000. That $500,000 is immediately then recognized as income, and this will affect your premium on your Medicare 2 years later. So again,
Correct.
It's all part of planning, right? So critical to plan it out. Take some of it 1 year, maybe some of it a second year, maybe some of it even a third year, where you can stretch it out so that you can avoid yourself from paying an extra amount of premium for your Medicare Part B. It's a real call out, an important thing to think about in planning. And then,
true.
Yeah, and so true. You know, I talk about this, we talk about this all the time. It's taxes is a critical component of everyone's retirement. And we want to try to minimize those so that you can maximize your retirement income for joy, but minimize expenses. This is an expense triggered by bad planning. So please make sure you're doing good planning here.
Absolutely. Thanks, Tom.
Yep.
So now when we're looking at the additional cost specific to Part B, again, Part B does have a deductible. This time it is an annual deductible of $226. After that, Medicare Part B has what's referred to as coinsurance. So that's essentially where Medicare pays for a percentage of the covered costs, and you're responsible for the remainder. With Medicare, it's essentially an 80-20 split, meaning Medicare pays for 80% of the cost. You're still responsible for 20%. Again, there's no maximum out of pocket with this. So 20% of an infinite number is itself an infinite number. There are fairly costly procedures that people can go through that are covered by Part B, where 20% can be a substantial amount. So whether your bill's $100 or $100,000, you're going to be responsible for 20% of it under original Medicare. So we've talked a lot about what's covered and what the costs are under Parts A and B. Let's talk a little bit about what's not covered. Most dental care, vision, routine hearing. Again, one of the bigger call outs here is actually long-term care. So Medicare is not designed to cover what they refer to as custodial care or long-term care. That is one of the bigger planning areas that I encourage you to talk to your financial professional about to make sure that you have a plan in place to deal with that expense.
Yeah, you know, just to kind of, again, focus on that, I just finished reading an article, Robert, that they said 30 to 40% of the people surveyed felt that they had long-term care insurance, when in fact, that is not true. The true statistic is only 3.1, 3.2%. That's it. 3 to 4% of the individuals actually have long-term care insurance coverage. The reason people misthink this is that they think that Medicare is long-term care insurance, as you just pointed out. It's not. Another thing they think about is, I have a long-term disability policy. Well, that long-term disability policy typically stops at age 65. So that's not designed for long-term care either. So it's a real call out. I've seen this happen. I've had it actually happen in my own family as well. And I know how expensive long-term care can be. And it's very, very important to make sure you think about it and plan accordingly.
Absolutely. Thanks, Tom.
Yep.
So then the other part of original Medicare is Part D. These are the prescription drug plans. These Part D plans are run by private insurers authorized by Medicare. It's important to know that there are a variety of those plans out there. Each plan has a different drug formulary, meaning that they have different drugs that they're approved to cover and at different coverage levels. So those plans are really important to look into based on your specific prescriptions that you're taking. And that way you can compare the premiums on those plans as well as the out-of-pocket costs that you'll have for your prescriptions on those plans. It's also crucial that you review those each and every year during the open enrollment period, which begins October 15th. Give you one, example of a client I helped with this a few years ago. Had she stayed on her existing Part D plan, her prescription costs were going to go up to about $80,000.
Wow.
And by doing this review, we were actually able to cut that back to where she still had some significant costs, but we lowered that down to about a $6,000 cost instead, just by choosing the correct prescription plan for her.
Yeah. There's one more thing I'd like to call out, Robert. Maybe we can
Yes.
talk about this. Is if you notice in this slide, you have the individual income and you have the married income, these two columns, depending upon if you're married or if you're single. And one thing that we see from time to time is people don't recognize that, well, I have joint income, and when one spouse passes away, what happens? Well, the income might stay about the same. It might truly stay very close to the same amount of income. And what happens, though, is they get shifted from the married income column over to the individual column. And sometimes it'll then increase the survivor will actually have premium payments when they didn't necessarily have it when they were married. Isn't that a true statement?
That is correct. So this works just like it does for Medicare Part B. If you make over the threshold, you do pay an additional premium on top of the Part D premium that you're already paying. And yeah, in the situation you described where one spouse passes away, but the surviving spouse's income stays relatively similar, you could see suddenly an increase to the Part D premium based on that single filing status.
Yep.
So now we know what original Medicare looks like, Parts A and B and the Part D prescription plan. Obviously, it was never intended to cover everything and leaves quite a bit of exposure out there. And for that reason, people usually go onto Medicare in one of two ways, either through a Medicare supplement plan or through a Medicare Advantage plan. So let's cover kind of some of the features of those two things. So the first option is to go on to original Medicare, Parts A, Part B, just as we described, but add on to that coverage your Part D prescription plan, and then either a Medicare supplement or what's also referred to as a Medigap policy. The advantages of doing that are that the Medicare supplement policies work nationwide. So whether you're seeing a doctor here in Arizona or if you're visiting kids in New York, the plan works the same in both locations. You don't have any networks or provider networks, so you get a lot of choice in designing how your plan works and what doctors you want to see. You don't have to worry about referrals to go see specialists. And the coverage on the Medicare supplement plans, as we'll see in a minute, are quite comprehensive. Of course, you do pay an additional premium for that level of coverage. The second option is to go with a Medicare Advantage plan, also known as Medicare Part C. These plans are offered by private insurers. They're intended to be an equivalent of what you get under traditional Medicare. Typically, you're going to deal with either an HMO or a PPO plan on the Medicare Advantage side, which means you are going to have provider networks. There may be some geographical limitations to the plans. So it may not work as well out of state as it does in your home residence. But they also frequently have some added benefits, including dental, vision, and hearing coverage, gym memberships, things of that nature. They have a lot of times here in Arizona in particular, a lot of these plans have no premium. Some of them have a very low premium. And then while you do have copays and other out-of-pocket expenses, they do at least put a maximum on those so that you know that there's a ceiling on your expenses through the Medicare Advantage plans. Those plans also include your prescription coverage without the need for a separate prescription plan. So let's go back to the Medicare supplement plans and what those cover. One thing to keep in mind is whether you're married, single, divorced, widowed, whatever the case may be, each member of the household goes on Medicare as an individual. So that means there are those households where one spouse chooses to go on to a Medicare Advantage plan while another chooses a Medicare supplement plan. It's really particular to their situation. But either way, you do still have those two choices, original Medicare and then the Medicare Advantage. Our next slide is going to go over some of the actual coverages of the Medicare supplement plans. So first thing I want to point out on this slide is you can see the highlighted plans C and F. Those are no longer available for new Medicare entrants or folks who became eligible for Medicare after January 2020. The other important thing to note about the 8 remaining Medicare supplement plans out there is that they are all standardized. What that means is that every insurance carrier that offers a Medicare supplement G plan, for instance, the coverage is the same. So the key things you're looking at when you're shopping for Medicare supplement plans are really how much premium is getting charged and are you getting an appropriate level of customer service from the carrier. Looking at the G plan in particular, you can see, as I noted earlier, the plan is incredibly comprehensive. All of those Part A and Part B expenses that we talked about under original Medicare are covered by the G plan at 100%, with the one exception being the $226 Part B deductible. So this again gives you the flexibility to have a lot of choice in the care that you receive, as far as choosing doctors and locations, and also gives you a lot of certainty when it comes to your yearly medical expenses. You know, your costs will be limited to the premiums that you pay for the plan, as well as that $226 Part B deductible.
Another call out, I've seen this happen on a rare occasion, but it does happen that people have selected a plan option but didn't think about the foreign travel component. And as we are, when we get into our retirement years, many times we do want to travel and we want to go places and do things out of our local area or even in a foreign country. So that is a cruel call out. Again, if you're going to be traveling or traveling even in a foreign country, you need to make sure your healthcare coverages are adequate.
Yeah, and that's correct. And the Medicare supplements do provide some foreign travel coverage, whereas original Medicare and the Advantage plans do not.
Yeah.
So then let's go over a little bit more detail in the Medicare Advantage plans. Again, those are plans offered by private insurers. They're required to cover everything that Medicare would cover. However, they shift some of the costs a little bit differently so that you have a maximum out of pocket. You do still, however, have co-pays and some co-insurance. Again, typically those plans either have no premium or a very low premium. They are able to wrap in some additional benefits such as dental, vision, and hearing. A lot of plans will offer a free gym membership, and they include your prescription plan. Their coverage, however, is not standardized the way the supplement plans are. And in fact, their coverage can change from year to year. So if you do go down this path, it's crucial that every year you review the plan, make sure your doctors are still in network, that your prescriptions are still adequately covered. Just make sure that there isn't another plan that better meets your needs during that open enrollment period, which runs from October 15th to December 7th. So the question we get asked a lot is, well, which is better? And the somewhat unsatisfying answer is it depends.
Yes.
It really is situationally specific. I can tell you that when you're dealing with the Medicare supplement plans, there is what's called a guaranteed issue right when you're in your initial enrollment period with Medicare. So again, that 3 months before your birth month, the birth month, and the 3 months afterwards. What that means is that the carriers are required to issue the plan to you at their preferred rates, regardless of any health conditions that you may have. However, once you get outside of that window, the carriers can look at your health conditions and either charge a higher rate or decline coverage altogether. So if you have some health issues and you think that the Medicare supplement plan is the way that you're going to go, then I would encourage you to get the most robust plan that you can when you have that guaranteed issue period, because otherwise you may not be able to and likely won't be able to get that plan later on. And again, Medicare Advantage, while it's overall cheaper to have it because you're not paying as much in premium, it does cost more to use it. And those plans, as I mentioned before, do change from year to year. So now when we look at the challenge of healthcare costs, there are several things to understand. As Tom mentioned earlier, this is one of the largest expenses in your retirement. So it's really important to have a plan to cover those expenses, whether it be a Medicare supplement plan or a Medicare Advantage plan. Medicare only covers a portion of that. So it's crucial to have something else to help cover your additional exposure. And unfortunately, the problem is not getting any better. The cost of healthcare is rising. So planning for this is really a crucial issue. This is really something you need to start thinking about before retirement. As we discussed, there are some implications as far as the cost of Medicare in terms of premiums, depending on your income level. There are some implications depending on what your health is, and just overall, it's part of a good retirement plan to get educated and make sure that you've discussed a plan for covering these costs, as well as the cost of again, long-term care, which is not covered by Medicare or any Medicare supplement or Medicare Advantage plans.
Yeah.
All right, so let's recap real quick and look at kind of the key takeaways from this presentation. So again, Medicare is a federal program that provides healthcare coverage for those over 65, or if you have a qualifying disability or disease. There are premiums for Medicare, deductibles, co-payments, and co-insurance. It's important to plan for those expenses, whether it be by Medicare supplement or Medicare Advantage. And then again, when it comes to enrollment, if you're already receiving Social Security, your enrollment should be automatic. However, signing up for the Part D prescription plan or choosing a Medicare supplement plan or a Medicare Advantage plan is not automatic. And I'd encourage you to speak with a professional, make sure you're making a good choice on which route you want to take in that respect. Those who don't receive Social Security do have that 7-month window to sign up for Social Security. Again, that's the 3 months before your birth month, the month of your birth, and the 3 months after. And those who are going to continue to work have the option to defer going into Medicare and continue on their employer's plan, and they can still get their Medicare coverage later without any penalty, and also maintain their guarantee issue rights should they want to go on to a Medicare supplement plan. Once you do go on to Medicare, those are really the two routes that most folks take, is either going on a supplement plan with a Part D prescription plan or going down the route of Medicare Advantage through an HMO or PPO and a provider network. And probably the biggest thing, and we've hit on a number of times, hopefully this helps you, feel a little bit more informed, but your next step should be really talking to a financial professional to help you make that decision on how and when to go on to Medicare and what route you want to take. And with that, unless you have anything to add, Tom, I think we're ready for questions.
Yeah, we do have quite a few questions. As I said, we had over 30 questions come in. So I thank you all for submitting those questions. Let's get through some of them as fast as we can. We do have about 15 minutes yet to go before the top of the hour. Okay, first question is, just beginning to get information on the subject of Medicare. Would also like any written materials available? Well, that's an easy question. Yes, we have a written booklet that we can make available to you. Again, we will be sending that out by your request. If you, we will have the advisors reach out to each and every one of you that are on this call, but also the material will be on our website. As I said, the handout will be there along with this presentation, and you can rewatch this recording in the future. Okay, number 2 question. Robert, maybe you can handle this one. It says here, summarize the advantages and disadvantages of the original Medicare versus Medicare Advantage plans. I think we talked about it a couple times, but you know what? Let's say it one more time.
Yeah, absolutely. Let's summarize real quickly. So on the Medicare, original Medicare with the supplement side of things, you do pay an additional premium. But in exchange for that additional premium, you're going to get some more comprehensive coverage, and a standardized plan gives you a lot more flexibility and choice in directing your healthcare. On the Medicare Advantage side of the ledger, those plans are usually lower in premium. A lot of them are in fact free. But you do have various out-of-pocket expenses, and you'll be limited to a provider network, and you may also be limited geographically as to where you can use that plan. But on the positive side of things, they do throw some added benefits in, like dental, vision, and hearing coverage.
Yep. All right, good. 3rd question. I'm focused on early retirement prior to Medicare benefits becoming available. I think what they're alluding to here is help me out maybe and explain what are my options. Well, I think what we need to call out here is that individuals that do retire early, Medicare doesn't start until 65, as we talked about. There are a few exceptions to that, but in large part, no, Medicare starts at 65. So you need health insurance. You could go without. That's going naked, but that's a scary thought and a very expensive thought if, in fact, something goes wrong physically for you and with you. So you need to make sure you plan. So some people will see right when they're retiring, there might be a chance where you might be able to extend your own company benefits through COBRA. You might be able to find a job, a part-time job that makes something available with the health insurance. Perhaps maybe you even have a spouse that you might be able to also attach yourself and utilize their healthcare benefits until you turn 65. But it's so critical to understand before 65, you're on your own, and you need to make sure you think through that and plan accordingly.
Absolutely.
Right. Number 4 is how soon before the date I want to retire do I need to contact the Social Security office? Well, I think you just said it a couple times already. Robert, you've got 3 months before the month of your 65th birthday, 3 months before, then you have your actual month of your birth, and then you go 3 months after. So a total of 7 months. So there's a 7-month window that you have to go and apply for these benefits. All right, number 5. Okay, Robert, how about this one? I'm on my husband's work insurance. I turned 65 before he does. Can I stay on his insurance as a supplement to my Medicare?
So the short answer is yes.
Yep.
So you have those same options. You can, at that point, you can go on to Medicare and forego the employer's coverage. You can defer your Medicare and stay on the employer's coverage only, or you can do a blend of both the employer's coverage and Medicare. And again, I would encourage you to speak with a professional to compare the consequences of all 3 of those decisions before making that choice.
Yep. Okay. Number 6 question is, can I defer Medicare since I am working full-time and have insurance through my employer? I think that's, yeah, the answer is yes, but you want to elaborate any more on that?
Yeah, just a little bit. So yes, the short answer is yes, you can defer that going on to Medicare until you leave the employer's coverage. Medicare doesn't penalize you for not being on Medicare as long as you have what they consider creditable coverage, which employer coverage qualifies for. One important thing that some people do miss is veterans who are relying on the VA for their coverage, that does not qualify as creditable coverage. So if you forego Medicare because you plan on getting all your care at the VA and later choose to go on Medicare, you can be subject to late enrollment penalties.
Yeah. Okay. Here's another one, number 7. Coverage for depression and counseling.
Yeah, so Medicare does cover mental health as well.
Okay.
Again, Medicare Part B covers anything that's medically necessary. So there is coverage there that includes counseling and depression. It'd be covered under your Part B and then covered by your Medicare supplement or Medicare Advantage plan accordingly.
Like that, with other diagnosis, that needs to be under doctor care, though, correct?
Correct.
Yep, doctor care and prescription. Okay, number 8. What should I watch out for when choosing a Medicare plan? Any trapdoors or hidden potholes there?
So let's talk about Medicare supplement plans and then the Advantage plans real quickly.
Okay.
So again, the supplement plans are all standardized, meaning that insurers that choose to offer Medicare supplement plans, the coverages are the same from insurer to insurer. So the things you're watching out for there are, again, price of the premium and then the customer service level, making sure you're getting adequate service.
Yeah.
On the Medicare Advantage plans, those change each year. And so it's crucial to make sure that when whatever plan you start on, that your doctors are all in network and that your prescriptions are well covered. And then it's crucial to review that each and every year during the open enrollment period.
Now, is it true, Robert, that if someone selects the Medicare Advantage plan, all right, and they go the year with that, but then they find it maybe not working as well as maybe if they went with a supplement plan. So when they come to that open enrollment, can they switch from the Advantage plan to a supplement plan?
As long as they've only had one Advantage plan during that 1 year period,
Okay.
they can still get their guaranteed issue rights on the Medicare supplement plan.
Okay.
So Medicare does give you that 1 year test drive of the Advantage plans when you first enroll. If you get beyond that 1 year period, however, now your ability to switch to a supplement plan will be based on your current health conditions and whether you're subject to higher rates or whether you'll be declined for coverage altogether.
Wow. It's okay. So that, again, a critical call out. Make sure you understand and investigate the insurability issue. All right. Number 9. When is the best time to apply for Medicare? Is it true that your Medicare costs are based on your last year's income? Well, I think we talked about the best time to apply, but more importantly, let's talk about that. No, the answer is no to that second question, and that is it on your last year's income? The answer is no. It's actually 2 years prior. They need to file, they need to process, and they go back and they look. So right now, in 2023 premium, it's based upon your 2021 income. So you see where we were saying it's so critically to plan accordingly so that when it comes time to pay those premiums, they're going to look back 2 years. So if you'd like to, you want to make sure you plan and strategize your income so that you don't push yourself into a higher and higher bracket for Medicare premiums than you need to. So again, I call that the importance of good planning in that aspects. Here's number 10, Robert. How are deductibles handled with secondary and Part D plans?
So I think this is referring to the Medicare supplement plans.
Yeah.
Again, those plans cover the Part A deductible, so the hospitalization deductible. However, none of those plans can cover the Part B deductible, that $226 annual deductible. So functionally what happens at the beginning of the year, when you start seeing your doctor, you'll pay out of pocket for the first $226 of doctor visits. And then Medicare Part B will take over, pay the 80%, and your supplement plan will pay the 20%. The prescription plans vary. Those again are offered by private insurers, and depending on the premium you pay, can have some different deductible levels. So again, just encourage you to very carefully choose your prescription plan based on the prescriptions you're actually taking. That way you're getting on a plan that's most cost effective for you.
Yep. Let's talk about, this is not a question on the list, but I want to ask this question, Robert. Talk about the premium itself. How is the premium paid?
Yeah, I'm glad you actually brought that up. So if you're on Social Security, your Medicare Part B premium as well as your prescription premium, typically just come directly out of your Social Security payment before it's even deposited into your account.
Yeah.
If you choose to have a Medicare supplement plan, those premiums are paid directly by you.
Okay.
And that's done outside of Social Security.
Okay. And that's key call out.
Yes.
All right. All right. Let's see here. Okay. Difference in plans. Not sure about HMO, PPO. Maybe you can just talk about that a little bit. What's an HMO versus PPO?
So HMO stands for a health maintenance organization. Typically, those are going to have a more rigid provider network, meaning that if you go see one of the network providers, the coverage will be pretty good. But if you go outside of the network, you'll have a substantially higher out-of-pocket expense. The PPO is a preferred provider network. It gives you a little bit more flexibility in seeing out-of-network providers. So you'll have a higher copay, but you'll still have some coverage there if you're looking on the Medicare Advantage side.
Okay. Another question. This is kind of a repeat, but again, we'll repeat it. It's important to hear it again. When am I required to sign up for Medicare and Social Security?
So, two-part question, I guess, on Medicare. If
Yep.
you're no longer part of your employer plan, you're going to want to sign up for Medicare in that 7-month time frame, the 3 months before your birth month, month of, and the 3 months after.
Of your 65th.
Your 65th, yeah, correct.
Yeah.
When you're talking about Social Security, you can start claiming as early as age 62, or you can defer that decision out until age 70.
Yeah. And we urge people, again, to plan accordingly. Again, just for Social Security, people make decisions a little times a little hastily. And the fact of the matter is they can, if by deferring Social Security a little bit, you'll actually feel a huge impact in benefit of larger and larger income benefits later in life. So pre-call out, the longer you can defer your Social Security benefits, and I'll call that just normally it's a better route for many to go.
Yeah, definitely a key issue to talk to your professional about.
Yep.
Because it can obviously impact a couple's income, but when we're dealing with a surviving spouse, that claiming decision can be crucial for the surviving spouse as well.
We're going to talk a lot about Social Security in November, folks. So remember to sign up for that November webinar on Social Security. All right. Another question, 14. What are the penalties for contributing to an HSA and enrolling? This is a good question.
This is a good question. So once you enroll in Medicare, you are no longer allowed to contribute to your HSA. If you do,
let's repeat that again. That's important for people to hear.
So yes, once you enroll into Medicare, you can no longer contribute to your HSA. Yeah. You can, of course, still have your HSA, but you can no longer make contributions to it. If you do anyway, you can face IRS taxes and penalties for putting that money in the HSA post Medicare enrollment.
Yep. Key call out there. All right. Here, how do you decide if you need long-term care insurance? What is a reasonable amount to purchase? And does Medicare cover long-term care costs? Well, that's a loaded question. Let me see if I can handle that one, Robert.
Sure.
How much do you decide how do you decide if you need long-term care insurance? Well, again, it's a very personal decision. If you look at your own family history and know that maybe others have experienced it, maybe living longer and knowing how that life is later in life, it's important to recognize that it is expensive and it is a true call out that you need to plan accordingly. As we said earlier, Medicare is not designed and never was designed to be nursing home insurance. So that's a critical call out, folks. You have to understand Medicare is not your long-term care insurance. So what you need to think about is, how do I plan for long-term care? Now, you can self-insure. That's meaning that you're going to spend your own money, or you could shift the risk over to somebody else. If you look at the odds of Medicare or the odds of needing nursing care, the odds range, and I've seen them as high as 40 to 50%, sometimes as high as 70 when you're looking at it as a joint couple, that at least one will actually experience long-term care. So it's critical to understand that nursing care is very, very important to think through. And then what reasonable amount there is to purchase. That's a great question. And that really can, again, range upon your own budget, as well as maybe where you live and what kind of facility or long-term care facility or area you would like to have that benefit. If you're in a more rural area, it may be a little less expensive than more of the metropolitan market, but also the level of care. Do you want a high-end facility that offers a lot of fancy things and fancy services, or something that's very basic? So again, that's a really good question to ask an advisor to help you and guide you through that process and understand the process. So I urge you, I've had myself, and the reason I'm passionate about it, I've had 3 members of my family go through it. I understand it, and I've had to deal with it personally. And those checks that you write for those coverages and those, or not the coverage, for the costs can be substantial. So I want you to understand, you need to know that it can come. All right, here's another question. If I have a spouse that never worked outside the home, does she or he have to pay a monthly premium for Medicare Part A?
No, as long as the working spouse has a sufficient work record, the non-working spouse can apply for Medicare based on that and will not have a Part A premium, and will have a standard Part B premium.
All right, that's good to hear. All right, here's another one, Robert. I hear there are penalties if you don't sign up for Medicare at age 65. Is that true? Can you elaborate?
It is true. So 2 circumstances. If you stay on your employer's plan, then you have what's referred to as creditable coverage, and you won't have any penalties. If you do not, and you forego Medicare, then you can be hit with a penalty of 10% for every year that you should have been on Medicare but were not. Additionally, there's also a penalty for the prescription plans. That's 1% for every month that you should have been on a prescription plan and weren't.
Yep. Good. All right, 2 questions. We have 2 minutes left. Let's see if we can get them.
All right.
How often should I look at my coverage, and how easy is it to change? Robert, you want to cover that one?
Yeah, so at a minimum, you're going to want to look at the coverage annually. If you're on a Medicare supplement with a prescription plan, you need to review that during the open enrollment period every year to make sure you still have adequate prescription coverage. The same is true with the Medicare Advantage plans. Again, those change year to year. They can change provider networks, change drug formularies. So those also need to be reviewed each year. It is easier to change from a supplement to an Advantage plan, as we discussed earlier. It can be more challenging to go from an Advantage to a supplement plan if you're outside of that 1-year test drive period. But it's important to review it every year, regardless.
Okay, good. Last question is pretty easy too, I think. Does Medicare change annually in regards to its costs?
Yep, sure does. The numbers we've talked about today are from 2023, primarily because Medicare hasn't yet released 2024's numbers, but those will be coming out here before the end of the year, and they do change each year.
Yep, so true. So true. Okay, well, I want to say thank you, Robert. Thank you so much. We got a lot of questions that have come in. Whoops, let me go back here. Again, I want to urge you all that are on the webinar, please visit our website, oneazwealth.com. You can see a lot of good information there. You can actually reach out for any of our advisors and ask questions, ask additional questions, or even schedule an appointment for some counsel. Medicare and planning healthcare costs are very, very expensive for us during our retirement years. We need to be recognizing how we're going to cover these costs, and are they part of our budget planning? So I urge you all to get that organized. So as you look at your wealth, I want you to know the OneAZ Wealth team of advisors stand ready, willing, and able to review your current plan, your current portfolio, and in light of today's economy. You know, there's no better time than the present for a second opinion. So I urge you, and we welcome your phone call. So please call us at the toll-free number listed right there, the 877-566-0517, or you can visit us at the OneAZWealth.com website for more information in creating your own plan. Again, thank you for joining us today. From all of us here at OneAZ Wealth, I want to wish you the very best for 2023. I want to wish safety, health, and wealthy. Take care, and we'll talk to you soon. Bye-bye.